Hello, today I'll be performing Foley care insertion on my patient today. So first we would confirm the medical order for a catheter replacement, and we would do what we do at the beginning of any skill, which is providing privacy, performing hand hygiene, explaining the procedure to the patient, introducing ourselves, and gathering the equipment that we need. We will need a catheter insertion kit along with, well, that's basically it. Everything comes with that. Well, before we get started, I'll explain some of the reasons why people might need a Foley insertion placement. Most of the time it's because the patient is retaining fluids and they can't properly void them out. This can be due to plenty different reasons, such as overflow incontinence, and all sorts of different reasons. There's some factors that contraindicate the placement of a catheter as well, such as having an enlarged prostate. Someone with an enlarged prostate, the catheter part is it's hard to get it past it, and they'll need a special accommodation, such as a catheter that kind of twists at the end, like it's bent. But after that, we'll drape the patient first. To get this procedure started, we'll first drape the patient in any areas that we're not performing the skill on, so above their kind of pelvic area and below, as we only need to really see their private areas. But after we do that, we would place a waterproof drape underneath the patient, which I already have placed here, and then we would perform peri-care by wiping the areas around either the penis or the vagina. So we would wipe down side to side, down the middle, wiping front to back, and then for the penis we would obviously do the same. We would just clean around it, generally just kind of make sure it's all clean. And then after that, we would remove the gloves and perform hand hygiene, and then we would begin the procedure. So first we would start by putting on some sterile gloves. So I will demonstrate that really quick. And we would just make sure to not touch the outside of the glove, and then kind of just slide the glove on, not touching the outside at all. And then since this glove is sterile, we can freely pick up the other glove, making sure to not touch the outside again. And then, since both gloves are sterile, we can now just bring these down, and there's our sterile gloves. So now that we have the sterile gloves on, we make sure not to touch anything that we don't need to. And then, before we'll start, I'll explain some of the ways that you can break sterility. If you have a sterile field set up and you reach over the sterile field, you are effectively contaminating the sterile field with potentially your arms or something falling onto the sterile field. Facing away from the sterile field can also break sterility. Touching your hands to unnecessary areas during the procedure that don't need to be touched will also break sterility. And yeah. So things like that. So we want to make sure we're sterile the entire time. Next, we would use our non-dominant hand, which is my left hand, to kind of stabilize the genitals before we insert it. So first we'll separate the labia, and then before we do that, we actually have to clean. We have to clean the area around again by kind of making the area kind of sterile instead. we would need to do this additionally because soap and water is not enough to just make sure. So we would use 3 of these swabs. We would do 1 down the side, discard that. We'll need to use all 3 of these. And then another one down this other side. And the reason we would discard these after every one is because rubbing an area, like say going back and then back again, would break the sterility and it would recontaminate what you had just uncontaminated. So once we're done with that, we're ready to put the tube in. So with males, you would just insert it, but with females, you would separate the labia first, and then you would tell the female to bear down. And then we would obviously lubricate the catheter tip before we place it in. And then we would just insert it. Once you start to see pee kind of coming down the tube, that's how you know you're almost in the right spot. You would just push it in 1 to 2 inches further than that. And then you would release the genitals and hold it in place. And hold it in place with your non-dominant hand as well. So you'd hold that there. We would then grab with our dominant hand a syringe to inflate the balloon. There's a second little catheter thing here, and we would just insert it inside of here. And then we would just bring that in. Now obviously this isn't in the right spot because there's this doesn't go all the way down, but it'll have to do. After we're done filling it up, we would remove the syringe and we would kind of pull back gently on the catheter to make sure it's in the right spot and that it's not completely either out or it can easily just come out. And then after that, we would remove our contaminated gloves, complete hand hygiene, apply clean gloves again to then secure the rest of the tubing to the patient's thigh, and then the bag as well to have it hanging over the side of the bed. And then after that, we would recover our patient and return them to a comfortable position. If their head of the bed is up, we would put it back down, discard of all of our used supplies, perform hand hygiene, and then document our procedure. Thank you.